Hello, everybody. Today we have Dr. Taruna Yadav with us, who is an Ayurvedic doctor from Australia, practicing for more than 19 years now. Dr. Taruna is a mental health specialist, and we are very fortunate to have her with us as a member of ASHA Healing Hub. Uh, Welcome, Dr. Taruna.
Thank you, Shivra, for giving me this platform. It's indeed always a pleasure to talk
Yeah, thank you
about
for joining.
Ayurveda with Asha.
Yes. Today, our topic of interview is Ayurvedic Panchakarma therapy for mental health. So, the first question which comes in our mind is how far can Ayurveda go in treating mental health issues?
Um, First of all, I need to tell what Ayurveda says about mental health. Ayurveda is also says that a person to have a good health, his mind, body, and spirit should be in balance. So it's not just the symptoms we are looking at, but we are also looking at the root cause of the balancing doshas in our body. So when there is a balance of physical and psychological elements, we feel very good and we feel healthy. So in order to be healthy, we have to be fit in mind, fit in body, and fit in our spirits.
Right.
And Ayurveda believes that when we are working on any imbalances, we can never be, when we are, I'm sorry about that. When we are working to balance our doshas, we have to make sure that we balance mind, body, and spirit together, not just treat the cause of the symptoms of the disease. And in terms of mental health, we do have very good procedures like the Panchakarma therapy, along with some Ayurvedic herbs, which can definitely go on reducing the mental health in today's scenario.
Okay. So, of course, and then what are the underlying causes of mental illness?
Mental health illness could be a lot of varied causes. It could be you have a perfectly normal day and suddenly you're agitated. You don't know. It could be rise of pitta, going down of kapha dosha, imbalance of vata dosha.
Okay.
It could be stress. It could be fatigue. It could be anxiety. It could be depression. And we sometimes just take it as part of our daily lives. We are just rushing through work. We don't realize it. We overtire ourselves. And these things lead to daily issues of mental health, which we tend to ignore. Mental health is a very vast topic. We can go on and on about it, but more concern is about the daily lifestyle challenges we take. When we are fatigued, we are doing physical work, we understand our physical tiredness, but we never understand our mental tiredness.
Correct. So you mean to say that it might be of not for a prolonged period, but which still can be a mental illness? How do one identify that I am suffering?
That's a good question, Zifra. To identify ourselves, we have to first be in connection with our soul and spirit. And that's where Ayurveda comes in place, because when people talk about mental health, they would talk about major psychological disorders, but tend to ignore smaller factors which may lead to them, like anxiety, depression, fatigue, tiredness, everyday cause. Take about life of a working mom. She would get up, make sure the kids are ready, have the lunch, dinner, everything ready, and then come back, go to work, do the job there, and then at the end of the time, making sure she's rushing back home to look after the kids and family again. It's a continuous cycle she's going through. She's physically tired, but she does not realize how mentally tired also she becomes. And then the prolonged working hours of this cycle leads to mental stress, forgetting stuff, mind fog, not able to concentrate, losing confidence, getting angry, emotional outbursts, not knowing whether she's crying or she's laughing or lack of emotion.
Right.
So
Yes.
these are small triggers, and we think, oh, it must be something the kids said, or it must be the hormone changes. But
Correct.
what we're not realizing is it's a regular cycle every day. We don't take a break. We don't relax. We do meditate. We do yoga. We go out, have fun with friends. But then there is this deep section where we feel very lonely.
Yeah.
We don't realize it. Our subconscious mind, we need that company. And then when we are sitting alone, that's where we realize what are we doing.
Correct. And since you mentioned about subconscious mind, I think it gives hints. Our subconscious mind gives hints that something is not right somewhere, isn't it? We need to pay it to that.
Yes,
Right.
because our body and the way our body is made, our body is the best doctor. If we are in tune with our spirit and mind, we can actually understand
Correct.
and work towards being a healthy life. When we are tired,
Mhm.
our mind just goes down in a numb phase and tells us to relax. Our body gives us warning signs there is pain and aches.
Correct.
Relax. What we tend to do is ignore it, take
Mm.
a pill, or maybe, oh no, we need to work more. So it's just a cycle. No, it's your body giving you those small warning signs.
Right.
When you start forgetting things, when there is mental fog, you know you're doing something and you then suddenly forget. Oh no. When you get anxious,
Yeah.
you're fully prepared, you know everything. There is a bit of anxiety.
Mhm.
Then there is a small hints of depression. In
Mm.
terms of being lonely, you are sitting with everybody, but you're still lonely.
Mhm. Mhm.
You can't connect with people on a very intellectual level. You're connected with people with physical level, but what about that emotional level?
Correct.
And
Right.
we tend to ignore this a lot in our lives. We just carry on. We think work is priority, or raising kids is priority, or paying the bills is priority, chilling out with friends is priority. But all those things, the main priority where your body is telling you you need to look after yourself is when you're sitting alone with
Right.
yourself.
Right. Right. So we need to let our body do the talking a little bit
Yes.
instead of snubbing them with pills. Yes, I understand.
And this is where the Ayurveda comes in, because
Mhm.
when the doshas are in balance, you tend to connect yourself. You,
Correct.
you listen to your intuition, which is your body telling you.
Mhm.
Intuition, people give it a lot of different terms. But for me, I have realized when people have gone through different Ayurvedic procedures, they say, oh, now I can actually listen to my body.
Right.
I shouldn't eat raw food. I shouldn't eat greens. I shouldn't eat coal. I shouldn't eat chilies. And
Correct.
my body's telling me I need to do this right now.
Exactly. Exactly so. So, Dr. Taruna, in connection to this previous question, since many of us do not recognize our health problems, we talked about the problem of the mom, but which are the general or common health issues that fall under the category of mental illness? Why I'm asking is because, again, what I understand from talking to a lot of people, they do not know that they have the problem, and when the problem actually goes up to something crosses the border, they finally get in touch with the doctors. So, which are the general common health issues?
So, initial would be lack of sleep.
Mhm.
You're thinking awake all night or day. You go to bed, but you wake up tired.
Mm.
You fall asleep, but you have a lot of dreams. You don't know what's going on. You
Uh-huh.
remember the dreams in the morning, and then you're connected in your dreams.
Mhm.
Tiredness of mind, fatigue of mind, which in turns tell you you can recognize the slowness in doing everything. Like you're walking around, it's slow, but wherever, not able to understand the basic things, as in very simple things of I left my keys here,
Mm.
and 2 minutes later I'm searching around for my keys.
Correct. Very common one. Yeah, it happens.
And then when people are trying to talk to you, can't understand what they're saying, can't make sense of it. You get angry at small things, or
Mhm.
you get very emotional. So these are the points where you need to check
Right.
do a self check, realization. Mind is running at super speed. So these are the things where you need to find out
Correct.
that there's something wrong.
Even the younger generation is also having a lot of problems, which they are not fathoming it very easily. So can you
Yeah.
touch on those lines? Because the teenagers and the young people are also suffering a lot of mental health. So if you can touch that.
The mental health for teenage kids is more about the expectations and demands.
Mhm.
Doing too much things in too small time to get achievement, no lack of impatience, doing things quickly, being on the phone all the time, playing games, social media.
Correct.
Social media plays its good and bad role, but in terms of teen, even comments made by family or friends talk about body image, talk about competition in getting marks, talk about people, behavior of people, talk
Correct.
about helping at home, lot of things, small things, and then comparison with self and other friends.
True. True. Yeah.
And
And social
they,
media do play a very big role in this comparison part. Yeah.
yes. So you see photographs of people doing things and you're like, oh, I can't do it. Or
Yes.
maybe they're having fun and you don't know how much is real and how much is cropped. And maybe what they're sharing on social media would be what the
True.
other person is imagining. You never know the story behind.
Correct.
And also the technology has made the connection go away, nuclear families, which is a big part in mental health, because there's a saying in Australia, and I think it's also popular in every other part of the world, that it takes a village to raise a child.
Yeah. That's very true. Yeah.
And
Yeah, please.
my understanding is when you are in that close network of friends and relatives, kids learn different things from different individuals. And when you're in a nuclear family, everybody is rushing. Nobody has time to talk to each other. They feel isolated,
Right.
neglected, or they feel too overconfident to do everything.
And they
So,
randomly pick up the information without knowing which is right or wrong. I mean, that's not the
yes,
right age to decide also. Yeah,
yes,
very true.
that's true.
So when we talk about Ayurveda and we talk about mental health or any chronic thing which perturbs our life, Panchakarma comes in.
Yeah,
So what function does Panchakarma play in the treatment of mental illness?
Panchakarma is very effective in mental illness treatment,
Mhm.
as it is removal of toxic waste from the body. A very good example is a lot of clients where I see they come, oh, I'm doing yoga, I've done meditation, I feel good for some time, but then suddenly everything comes back to me. And if I forget the practice, it will still hit me. If I continue do it, I'll feel good for 6 months, but it comes back again. The reason is that we're not removing the root cause
Mm.
of what has caused these issues. If there is fatigue, what is the root cause of the fatigue? Rest,
Mhm.
requirement, and the imbalances in doshas. So when we are meditating yoga, we are helping our body, but what are we doing is we are settling down the toxic waste, which is Aama in Ayurveda. So Panchakarma helps to remove the Aama, the toxic waste, and balance the doshas.
Mhm.
And it is very important. And I would recommend everybody should at least get Panchakarma done once in their life, not only in relation to mental health, but also to
Yeah.
maintain the healthy lifestyle
Mhm.
and maintain that balance of body, mind, and spirit.
Mm. To bring in that balance.
To bring in balance, because life is about balance. We are trying to make balance every day, work and life balance, family and colleague balance, friends and family balance. But when it comes to mind, body, and soul balance, we just forget it because we ignore our bodies to the last limit till it breaks down, and then we try to rectify it.
Correct, correct. So still, the Panchakarma is very gray and not very known to a lot of people. People think it's little some massages or certain detox drinks. So if you can briefly talk about what Panchakarma is so that people know what exactly it is?
Yeah, so Panchakarma is a bigger picture. Detoxes, massages form a part of Panchakarma. Panchakarma means 5 main karmas. 5 main karmas are Virachan, Anuvasan, Basti, Nasya, Astapan, Vaman. How do these help? So when we are treating Panchakarma, when we are talking about Panchakarma, we divide it into 3 steps. It's a Purva Karma, Pradhan Karma, and Paschat Karma. So in Purva Karma, we have to first prepare our body.
Correct.
So when we're doing a Panchakarma, we can't just throw anybody inside it. It's our bodies are so tight and like a log that if we are trying to carve or make something, it will break. So what we need to do is we need to actually oilate and give a lot of swedan, which is steaming. So Snehan and Swedan form the part of Purva Karma. Then the Panchakarma comes in, which is the Pradhan Karma, where we have Vaman, Virachan, Anuvasan, Basti, Nasya, and Astapan. So these form the part of Panchakarma. Then comes the Paschat Karma, where once we have stimulated that removal of toxic waste, how to balance it now? So with regulation of proper diet, meditation, yoga, and asanas. So that forms a part of the Paschat Karma.
Correct. And the guidance are also given that these are the lifestyle which you need to follow after this treatment.
That's right. After the treatment. So a lot of people would do everything right. Well, we're following a proper healthy diet. We're doing exercise. We're doing this. But have you actually cleansed? When you're cooking food in a vessel, do you just wipe it and start cooking again? No, you clean it properly.
Very true.
And then you start the whole procedure. But what we do is we're doing everything fine, but we're not cleansing the toxic waste which is stored in the body.
True. So basically it is, otherwise it's a superfluous treatment. It doesn't go deep. True.
Yeah, it doesn't go deep. It doesn't go there. You can go in for a sauna treatment. You can go in for a massage. But what it is doing is it's moving the doshas. It will give you relief for some time. But you have to eliminate those out of the body.
Correct. Right. Dr. Yadav, is it possible to entirely treat mental disorder with Panchakarma? And what is the typical treatment time for the entire process?
See, I cannot give 100% assurance to treat entirely through the mental disorder because it's a long treatment and depending upon individual's case. So every case is different.
Yeah, plus, in general, suppose somebody is suffering from anxiety or depression, then is it possible to treat it?
It is very much possible with the Panchakarma therapy and Ayurvedic herbs to treat depression, anxiety, fatigue, mind fog. Very much there, but it has to be a regular treatment. You cannot just walk in, except it's magic. You have to go through the whole procedure. So Ayurveda is also about discipline. Panchakarma is discipline.
And in
so
right
you have
time.
to right time. That's right. Yeah. So you have to follow the right procedure. It takes from 21 days to 45 days for any treatment to last. But that is the start of the treatment. Again, depending upon where the individual is at, it could be 21 days or repeat of 21 days after every 6 months. So it's an individualized treatment. I cannot tell you, okay, you do 7 days now and you do 8 days. So every case is individual. And depending where they are, we can always advise those treatments. Some people might need 15 days. Some might need 21, and there are people who might need even 45 days of treatment.
Yeah. So average 3 to 4 weeks is the time for Panchakarma. And once again, it might be advised by the doctor when again you have to do that.
That's right.
Based on the condition of the patient. Yeah.
Yes, because without a proper prescription, you can't do the Panchakarma correctly.
Correct.
So you need to see a registered Ayurvedic doctor and to get that script. And also the whole Panchakarma, the best place to be done is in India.
I was coming to that we cannot do it suddenly from home.
No, we can't do it. It has to be done in a place where it is monitored. There is a doctor 24/7 to monitor you, and there is a therapist who's looking after you. So you have to be in a very trained environment where if the support is with you all the time. So they're going to check your doshas, they're going to check your pulse, they're going to do the tongue analysis, they're making sure that you're having the right meal, the medicine required during the Panchakarma is to the right dose. So Panchakarma definitely cannot be done at home. You need to go to a registered practitioner at a qualified center. So it's not just some massage or some oilation or some therapy like that.
Yeah, and in West, it is very difficult to do the entire process. So
that's right. So in West, there's a process called detox, which is similar to Panchakarma, but not in terms of full capacity.
Right.
Yeah.
That's a misnomer. A lot of people have that yeah, I do a regular detox and I take massages, so I am doing Panchakarma. That I have heard.
Yeah, no. Yes. So we do get people, our clients who say that, but it's again a misnomer. And we try to advise them that no, it's a different procedure altogether. And due to legal issues, Vaman and Virachan, the two Vata and Kapha pacifying treatments, we cannot do them in West. So they are, because they are to be done at a monitored, under the monitor, they are to be monitored under the doctor who's there, who's qualified and who can monitor how many Vaman yoga you have, how many Virachan yogas are there. So it has to be done under supervision.
Wonderful, wonderful to know it from you. Yes, we have those treatments with us. We have doctors like you in our healing hub. And of course, people are curing themselves. They are traveling to India and they're getting treated. They're happy. So yes, in future also, we would love to know a lot of other ailments which can be treated through Panchakarma and Ayurveda. So we are looking forward for more such advices from you. Thank you for today, Dr. Taruna.
Thank you, Shivra. Thank you for your time.
Thank you so much. Namaste.
Yeah, namaste.